Temporary. That's what provisional. Okay. So, like I told him, we're getting him in on the emergency status, you know, helping him out. It's really sensitive. He lost that filling. It's sensitive. All the nerves of that dentin are exposed when he drinks hot and cold liquids. Ooh, it bothers him. Huh. Miss Nicole, can you bring me the IRM?
Yes.
I forgot to grab it when I dropped off my spatula. So what I'm going to do is I'm going to place a temporary filling for him, and then he actually has to fly to Dubai for a meeting, and then when he comes back, we're going to do his actual filling. Okay, so this is going to get him by. So we assembled our correct supplies. So you're going to need your basic. You're going to need a Woodson. You're going to need a colloid discoid. You're going to need a Hollenbach, your liner applicator, your cotton pliers, your articulating paper and holder, a spatula, your Zoe, and your lovely spatula or mixing pad. Okay. If this filling happened to be an MO, what would we need to help put this filling back in? A matrix. Okay, so I know that this is just an occlusal, so I'm not going to need to get my matrix, but if it was, we would have to have that. Okay, so we are going to clean and dry the sites and isolate it with cotton rolls or dental dam. We're not going to do a dental dam. We're going to do some more cotton rolls. I'm going to use my long finger here. 1, 2, and I'm going to grab 3 because 3 is fine. Okay, we examined the tooth, making sure that, you know, everything looks good. Yep, he completely cleaned that out of there. That's, whew. If the patient was super sensitive, then we would have to have doc obviously numb him, but he's gonna tough it out. Okay, so what I'm gonna do is I'm gonna mix my IRM to second consistency. What is that?
1
Yep, 1 to 1. So before I mix this up, I'm not gonna isolate quite yet. Why? Oh, I get.
Do you need a more
I
flimsy
need
spatula?
the thingy bobber, the scoop. Is it in here? Oh, here it is. Here it is. Thank you. I'm sorry.
Sorry.
No, you're good. Because this is gonna take me a minute, right? And if I have cotton in his mouth, what do you think he's gonna do? Salivate, and it's gonna get all soggy, right? We don't want that. So remember, you fluff your powder, always recap. 1 thing of your liquid. Whoa, that was 2. I'm gonna soak that up. You like that? That was what we would do if you decided to squirt out more than what you needed. I don't even know if that was a good 1 drop or not. We will see. It's too dry. I'm gonna redo that one. I could tell. Store where you can get like your truffles and caramel apples and all that stuff. And for homecoming, the girls did a charcuterie, and so Lily did desserts, and Dustin got her some Dubai chocolate, and so I got to try it, and I was like, okay, not bad.
Do you see all the hype about it though?
I do, because of the layers of stuff.
What kind of layers are there? I never had it.
Yeah.
It's
It's
like
really good.
It's like a Kit Kat?
pistachio.
Mm-hmm.
A little bit. It tastes like a Reese's though,
Oh.
to me.
All right, Bob, I'm gonna go ahead and get this tooth all nice and isolated. Please bear with me here. Am I gonna do this?
Oh.
Why?
It's sensitive.
He's sensitive, yeah. Yeah, just a little. What else could I do if he couldn't handle the air?
Try it with a 2x2.
Do you think a 2x2 is gonna fit in there? You can pull off a little piece of your cotton roll to make a cotton ball, and I could dry it in there like that. And I'm gonna do that because he can't stand it. Okay, I have my material right here. Do you think this whole entire thing's gonna go in his mouth? No. I'm gonna just take a little piece off like that, and you're gonna incrementally fill it. Okay. There we go. And then I have my Woodson here to help condense it. Fill out. I'll get some more, don't worry. Paddle end can take some of it. Remember, ladies, these are plastic teeth, and it doesn't really act like what real teeth do. So when you're packing this in here, you may have to kind of use your finger a minute. Always wipe off your spatula as you're going, or the paddle end and your condenser, because if you keep having IRM on the condensing part, it's gonna stick to the rest of it, and then it's gonna pull it out. Okay. There we go. I'm able to pack it in. Get a little more with the paddle. Basically, I'm just taking it like that, and then I'm going and I'm just kind of wiping it right on the edge, wiping off my paddle, and then now I'm packing it with the condensing end. Okay. Overfill it, because then now what are we gonna do after we get it all filled? We're gonna carve it. That's why we have our colloid discoid, we have our Hollenbach. Beautiful. Okay, next in line, colloid discoid. And you're just working from your center pit up to the slope of your cusp on the buckle, and then you're gonna do the same thing on the lingual. Going from that occlusal pit and moving it up. I'm wiping off my instrument each time. All right. Take a peek at my mirror, because I can directly see what I'm doing. If I can't directly see, gotta use our mirror. Now I'm gonna carve my initials, because Bob wants to take a piece of me with him. No. We always would joke with our patients, like, I just drew a little smiley face in there for you.
I've done that when I cut people's hair. Like guys at the back, they're like, nah, it's okay, I trust you. And I'm like, oh, you can do my initials on the back.
Mm-hmm. I signed it. Okay, that looks pretty good. I think that feels good. Okay. How would I take this off?
You would wet it and
Okay.
then cotton.
You're not ripping the lining of the new coat.
Perfect. Alrighty. Do you need to swallow? Yeah. Okay. Okay. Wow, my tooth feels really good. I'm like, I know. It's that eugenol and that Zoe. He's biting on articulating paper. Why?
Check the bite.
Yeah, we don't want to leave this high. And if I look in here, everything looks pretty darn good. If I were to have any of these blue spots, red spots in the direct center of our tooth, I go back in with my colloid discoid or my Hollenbach and I carve it. Because this hasn't fully set up yet, it's still pretty manipulative, and it hasn't gotten hard. Okay, so you're still able to carve off, if you need to, a little spot, which I'm gonna do right here. There we go. And then I'm gonna say, go ahead and bite down, Bob. How's that feel? Grind around. He's like, yeah, that feels pretty good. I'm like, yeah, it looks good. Then, before we're done, I like to use the 2x2. I didn't really absorb it. And that's what I use to wipe off the restoration, and then also the opposing teeth where we were biting earlier, because that's gonna mark, because it's double, right? Getting it upper and lower. So now when he bites down, his tooth is no longer blue or pink, depending on your articulating paper. And that looks pretty good. Okay, and it says a wet cotton tip applicator. I find that this is easier when it's nice and wet, because you can put it around your finger and you can get into those grooves, versus a cotton tip applicator is pretty big, pretty hard. If it was on a big molar, then yes, by all means, but this is on a premolar, it's kind of tiny. You can even use another cotton pellet, same thing, to help kind of wipe it off. Okay, but I guarantee you a cotton tip applicator is not going to get that wiped off, because it's so tiny and the cotton applicator is so big. So now we're going to give him proper post-op instructions. Okay, so this is a temporary filling, right? It's now starting to set up. Okay, Bob. So we have that temporary filling in there to help calm that tooth down until you come back from your trip to get your permanent restoration in there. So what I want you to do is avoid eating on that side, okay? So today when you have lunch, eat on your left side. Also avoid eating anything sticky and chewy. All that caramel that you were having, you're gonna have to lay off of that for a little bit, okay? Because it's just gonna pull it right off. This is temporary, it's not permanent. So wait a good 12 hours to really eat anything on that side, and then after that, you're good to go. Make sure when you do eat on that side, you avoid anything sticky, crunchy, chewy, okay? You think you can handle that, Bob? Yes, fine. Okay, alrighty. And so now we're going to care for and clean up our supplies as needed, okay? So basics obviously get re-sterilized, right? Everything else can be put back into the instrument cupboard. Please make sure you do not have IRM on any of those instruments before going back into the cupboard, okay? Make sure it's nice and clean. This is composite. That was left on here. So if you think about it, think I'm gonna get this off? No, I'm probably just gonna take this mirror and I'm gonna throw it away and I'm gonna get a new one, because that is just disgusting. So we always gotta make sure that we don't leave any of our restorative material on here, because once it gets in the autoclave, it's baked on forever. Okay, so I will get a new mirror head. Where do you think this goes? My pocket? No, even though I like it. Well, it's intact, it's fine. I could throw it away. But where do you think Miss Kate's gonna put it? Because she's just trained to put everything there except for amalgam. Sharps.